So this is our second annual Zika conference. First one came into being because we recognized that we had a problem with Zika emerging. We were able to get some funding from CDC to start dealing with it, and one of the things we wanted to make sure we could do is convene the stakeholders, especially the clinicians that would be involved in the diagnosis and treatment.
So what's so exciting about this conference is that it brings together all of the public health people involved, both at the city and the county level and the state level and the federal level, with some of the scientists, with some of the clinicians. If you really want to tackle a public health threat, by definition, it's an interdisciplinary problem. You have to bring in individuals of diverse backgrounds.
So I think what is really important about conferences like this is getting all of the players together, working together and meeting each other to combat from different fronts. And so for the infant perspective, I'd already been working very closely with our obstetric colleagues and our follow-up pediatricians and specialists, but not as much with the health department itself. And so reporting and things like that are definitely something that I am coming away with, and the importance of doing that back to the health department.
Well, the information is really very important because it was shared between not only the clinical side, but also the community side. And also we have cases from people coming down from the south, and also from our side when we come in from the organism, from the mosquito side, from the field side, where we go and survey for mosquitoes and manage them, and also talk about how we're going to take care of them.
I think it's really interesting to see a similar story, but from a number of different views. I think we've noticed some of our concepts are overlapping, but hearing what's going on the public health side or from the pediatric side or the obstetric, we get to sort of see how all of our puzzle pieces fit together. Often people look at a decreasing infectious disease as though we've put way too much effort towards it, and I think it's the exact opposite.
It's a bit of a balancing act, right? Because you don't want to be crying wolf, and we want to keep people thinking about it, and really what we want is for people to change their behaviors, especially in ways that can impact not just Zika, but other mosquito-borne diseases. So if you practice R3D Zika defense, which is all about dress, drain, and Deet, so wear long sleeves when you're in areas where you could be exposed to mosquitoes, use a Deet-based mosquito repellent or another EPA-approved mosquito repellent to keep the mosquitoes from biting you. Drain any kind of containers of standing water where the mosquitoes can breed. That certainly will help with Zika, and it'll also help with virtually all other mosquito-borne diseases.
And as we respond as a community to these illnesses that come upon us, we have to have the infrastructure, we have to know each other. So right now we're talking about Zika, but really what we're building is that community infrastructure and those interrelationships that we need to have between institutions and the public, so that when something occurs, we can quickly respond in a way that's going to really make a difference.
You know, Texas and Houston, the Gulf Coast, is turning out to be a very vulnerable area to infectious diseases, especially diseases transmitted by insects and other arthropods, because we're at the confluence of problems like poverty and human migrations and transportation and climate change. So by getting it right with Zika with a conference like this, it allows us to get it right for a whole bunch of diseases that will surely follow.
The hope for this conference is to keep vigilant. We have to keep educating ourselves, we keep our eyes open and looking for how to continue communicating and dialoguing so we can tackle the problem together.
A lot of the things about Zika can be applied to other congenital infections, other problems and epidemics that need multiple providers and health departments to work together. And so laying that groundwork can be really beneficial when something else comes along.
I think an important thing for folks to keep in mind is that we now live in a much smaller world. There are diseases that have been around, well, that we can document have been around for decades, but quite honestly may have been around for centuries. We just never recognized them. But once they start getting into folks that live in highly mobile societies, they're going to go around the globe in no time. So we have to be prepared to respond to that.